Let's move to our next thing. HIV/AIDS.
Yeah.
Is it that common?
Very common.
You are a public health nurse.
Yeah.
With your experience, is HIV/AIDS very common?
It's very common. It's becoming very common day in and day out.
Really?
Yeah. And very scary.
Very scary.
Yeah, with the youth. Especially with the youth from 15 and above.
15 and above?
Yeah.
They have HIV/AIDS.
Yeah.
Is it true when you have HIV/AIDS, you are going to grow lean? Is it true?
No, please. The HIV, we have stages.
Okay, so take us through.
HIV is the HIV, it stands for human immunodeficiency virus. The human stand for us, and then the immune stand for your immune system. Then the virus is the virus that attack your immune system.
Yeah.
Example, let's say in Ghana here at the border we have soldiers who protect the country. So when the soldiers are killed, anybody can just stand up and come to the country and that's whatever she wants to do. That's the same implies to HIV.
Okay.
So when the virus gets into your system, their mainly duty is to attack your immune system and then breaks it down.
Okay, so anyone, in simple terms, anyone with HIV means that your immune system is broken down like that. It cannot fight against any sickness or disease, right?
We have stages.
Okay.
So when you get to find out you have HIV, there is no cure, but there is management.
There is no cure for HIV?
Yes, please. But we have management. We put you on drugs. Yes, to boost your immune system.
Okay.
Yeah. We have something in us that's called CD4 cell count.
Okay.
Or the white blood cell.
Okay.
Its responsibility is to fight against infection. So the virus, they just target your CD4 cell count.
Okay.
So the management and then the drugs we give to you is to boost your CD4 cell count or your immune systems to fight over the HIV virus.
Okay.
To make it dominant, inactive. They will be inside you, they will be in your system, but they cannot work.
Okay.
So
it means when you have it, it's better for you to visit the hospital.
Yeah, that's why we normally educate the public on regular medical checkups. So when you check and you have HIV, then quickly we start putting you on medication for you too. Because the advanced stage of HIV is the AIDS. With the HIV, it can be controlled.
Okay.
But with the AIDS, that's the situation whereby you grow lean, and then you start coughing, and then you start showing the signs and symptoms of HIV.
So we have people who have HIV but don't have AIDS.
Yes, please.
HIV and AIDS, which one is more dangerous?
AIDS.
AIDS.
Yeah.
So there are people who are just around the HIV.
Yeah.
Can they transmit to someone?
Depending on their viral load.
Okay.
Yeah. When you are put on the medication and you take your medication correctly and you don't default, it will get to a point in time, even if you go and check, though the virus will be inside your system, but your result may come out as negative. Yeah, meaning the virus has been dominant, inactive.
Okay.
Yeah, it's inside your system, but it cannot cause any harm to your system.
So these people can have unprotected sex and they can't transmit, or we shouldn't take chances?
No, with that one, we shouldn't take chances.
So when someone has HIV, you are not supposed to have unprotected sex?
No, you can have unprotected sex. We have couples who are, one is positive, one is negative. Yeah, they have unprotected sex. We have medications we give to them. With the HIV, with the medication, we have the post prophylaxis.
Okay, what is that?
With the post, meaning we have the pre prophylaxis, and then we have the post. With the pre, let's say I'm having HIV, my husband is negative, then we have sex. My husband is supposed to take the pre-prophylaxis to protect him from getting
before sex.
Yeah.
So when he takes it, how long is he supposed to?
For let's say 7 days.
Hey.
Yeah.
You take the drug, you have to wait for 7 days before
when you take it, and then as you are having the sex, you take it along to 7 days.
Okay.
Yeah. And then we have the post. With the post, meaning I've been exposed. Let's say I'm a health worker, and then unfortunately I get a needle prick. The person is positive. They will put me on the post prophylaxis because I've been exposed.
So anytime you are exposed, you need to take some medication. What is it going to do?
It will prevent you from getting the HIV. Let's say you go out, you meet someone, you don't know the person's status, you end up having sexual intercourse with the person. You get to the facility, you talk to them, they will put you on that medication. You take it for 28 days to prevent you from getting the virus.
Wow.
Yeah.
And doctors, nurses, because I'm scared now for you people. What happened in the hospital when you give injection and
we have a needle prick?
Yeah, what do you do?
They put us on medication for 28 days.
It means you are at risk.
Yeah, we are at risk. Doctors and nurses are really at risk. But there is nothing we can do. That's the profession we chose.
Okay.
And we are supposed to make sure our clients are okay.
Can we prevent HIV/AIDS?
Yeah, we can prevent HIVs.
Are there medicines to be taken, like you take one pill and it can help prevent HIV/AIDS? How do we prevent HIV/AIDS?
With the let's start with the causes. With the causes of HIV, one is through blood contact.
Blood contact.
Yeah, through body fluid. Like the vagina fluid, the sperms, and then through breast milk.
Okay.
Yeah, and a mother can give to her unborn child through the placenta.
Okay.
Yeah, that's the more reason why when pregnant women, the moment you get pregnant, you are supposed to go to the hospital to do this medical routine.
That's HIV test.
With the HIV, hepatitis, and those kind of.
Okay.
So let's say if you are negative, you are good to go. But if you are positive, they put you on medication to protect you, the mother, and the child inside your womb.
Okay.
Yeah. So when the baby is born you are putting on medication. Then you can breastfeed, because through breastfeeding you can transmit the virus to your child as you are breastfeeding the child.
Wow.
Yeah.
Okay, so causes, is that all for us today? Then
let's say needle prick, and then on-screen blood, having unprotected sex. Example with our youth, they are naive. Some don't even know what sex education is. Some parents don't even educate their children on sex. But it's good to educate your child on sex. So as she's growing, she will know his or her left and right.
Okay.
Concerning sex. Yeah.
Okay, so can someone contract HIV/AIDS through kissing?
No, please. Unless there is a cut in the positive person's mouth.
How do we know?
Or deep kiss.
How do we know?
You can't tell.
So if the person has any sore.
Yeah. Or deep kiss. Sometimes some deep kiss can lead to some cuts in your mouth. Someone can kiss you to the extent that after kissing you see you having some
I think that is biting. I'm sure that is biting.
You'll be having some kind of burning sensation around your mouth, and with that one you can get HIV if the person is positive.
Okay.
Yeah.
Okay. Okay.
But with normal kissing,
They should continue.
yeah, you can.
Okay, so the youth should continue with the case.
No,
Can
because kissing can lead to something.
okay. What if it's a drinking cup?
A drinking cup,
Someone uses the drinking cup.
plate and stuff.
Yes, spoons.
No.
Oh, no HIV for
No,
spoon.
please.
Wow.
It's true blood contact.
So what if the person using the spoon has bleeding gum
After the person washes the spoon
with
soap
just
and
normal
water.
soap and water,
Yeah, soap and water.
and we are through? Just normal, and we are good to go.
Yeah.
Okay. How do we prevent HIV/AIDS? Is it preventable?
Yeah, it's preventable.
How do we do that?
Having one sexual partner, and before having sex with someone, you are supposed to know the status of the person. Yeah, condom use,
Okay.
abstinence,
Okay.
disclosing your HIV status to your partner.
Okay.
Yeah, regular medical checkups, especially with the pregnant women. Yeah, and then if you are being exposed to HIV, you are not supposed to sit at home.
Okay.
Let's say you are home and then you had a needle prick, and quickly you wash that site with soap and water.
Okay.
Then you run to the hospital.
So you are sewing with, let's say, a needle. You have a prick. As soon as possible, wash that area
You wash that area
with soap and water.
and then you go straight to the hospital.
Okay, for treatment.
They will first of all screen you yourself. Maybe you already have the virus, you may not know.
Okay.
And so when you are negative, then we put you on medication.
Oh, okay.
Yeah, because HIV takes some time before, like, you can start showing. Let's say today you by mistake you had HIV, or you came into contact with an infected blood. When we do the check, the screening, it won't show.
Okay.
It will take some days or some months, 3 months going before we will be able to know whether you have the virus or not.
Okay.
And with the testing, we have the first response.
this one can test for HIV
Yeah, for
instantly.
Instantly.
And instantly you use it and you get response.
You get the response.
Okay. Okay.
So let me.
Okay, so this is like a test kit.
Yeah, a test kit.
Okay, so
It's like the pregnancy test kit.
Okay.
So this is it.
Okay.
We
So
have the.
is it can anyone walk to any pharmacy to buy this?
Yeah, if you are bold enough.
Why people are scared to buy?
People are really scared.
When it comes to HIV.
Even when they come to the facility and they are sick and you try to do the
tell
HIV.
them
no,
HIV.
they won't even accept it.
Some people say the way you sometimes announce it when they have HIV, they will look at your face and tell you, young man, there is more life for you.
And when let's say couples, for instance, you come to the facility and then maybe the female is having the HIV, I don't have the right to disclose one's status to another.
So when a couple come to your facility to do an HIV test, and one is positive, one is negative, you don't have the right to,
unless the person tells you can.
How do you break this news to them?
First of all, you go for counseling.
Oh, so the thing there, counseling, because the moment you tell someone you need to come for counseling,
but there is still life after HIV.
Okay.
If you take your medications very well and you don't default, there will be a time you go and check and then the viral load is very down.
And is it possible you can go off the medication?
No.
You need to be on the medication.
Medication for life. That's the more reason why we are supposed to use condom. We stay faithful.
Okay.
Yeah.
We need to be faithful.
Yeah.
Okay. What else do you want to share with us?
I want to illustrate how to wear the male condom.
There is a way to wear the male condom?
Yes, please. Majority of us don't know.
Really?
So at the end of the day, after sexual intercourse, the person will be like, oh, I used condom, but the lady is pregnant and stuff. Sometimes after sexual intercourse, the condom will just burst and then the sperms will be inside the woman.
Is it? Do we have expired condoms?
Yes, please.
So if the condom is expired, is it possible it can break?
Yeah.
Okay. So how do I know the condom is not expired? How do I know?
We have expiring dates on it.
These boys will never check this date.
They are supposed to check. You have to first of all check your expiring date. So after checking the expiring date, you need to move the condom in the
Madam Ness, the boys we are talking about, they have time. It's time management.
So you do it before the match starts?
No, it's all. They never plan, no. And I'm sure the young men they will understand. The boys will understand. The stubborn boys at the back will really understand what I'm saying. But then, because some people have limited time available, and you want, Madam Ness, you want them to take and check dates.
It's very important.
Really?
It's very necessary.
And so, do what again? After
checking the expiring date, you need to see if there are holes in it.
Why? Is it possible there can be holes around the wrappers?
Yeah, around the wrappers.
Okay.
If not stored well.
Okay.
Yeah.
So where is the right place to store them if you have them at home?
Cool, dry place.
They want to hide it. Where they hide it? Madam Ness.
So you need to move it. If it is very sticky, meaning you are not supposed to use it, you discard.
If it's sticky, you are not supposed to use it.
Yeah, if it is movable, like the way my own is moving, then you use it.
Okay, so one way to check whether it's expired or is to move, whether it's going to move.
Yeah, there is lubricant around it.
But what if there is no, and you have shea butter? Can you?
No, please, no, please. Some even use baby's oil.
Some anointing oil, no problem. All pinty be pinty.
Yeah. So after moving, we have a zigzag.
Okay.
So you have to tear from the zigzag side.
Really?
Yes.
Hey.
So
since when? Hold on.
So there's the zigzag, and then so you are not supposed to tear from here. You tear it from the zigzag.
Where the zigzag is?
Yes, please.
No, this one I'm not sure. The boys at the back they are aware of this. So where the zigzag is?
Yeah, that's where you are.
I think they should come with a manual.
Yeah,
at least you buy it comes with a manual.
But when you go to the facilities, we educate you on it before. But with the pharmacy shop, I know they are quickie opening time, so she just go and buy it and do it. So
so it's easy.
Yeah.
Okay. Then what's next?
So you pull it out. Let's say this one is my ejaculated penis.
Okay.
Then you have to hold.
So this is what you teach?
Yes, at the facility.
And you are an expert in this?
Very expert.
Wearing condoms. You are an expert in wearing condoms.
I will show you.
Wow. Next. Okay. Let's go.
So you hold the tip.
Madam, are you sure the boys at the back will have that time to be going slow?
They have to.
Okay.
This tip, when you release the sperm, it will be inside. So you put it on it.
Okay.
Then you roll.
Okay.
You roll down. Then you leave the tip. Yeah, for sperm accumulation.
Okay, to open it, is it advisable to use your teeth?
No, please.
Okay.
Yeah. So that's it.
Okay.
So after the sexual intercourse, you just...
This how you take it off?
Yes, please.
Wow, then they've been doing it the wrong way.
Yeah.
Okay.
You pull it down.
Okay.
So when it gets to the tip,
then what else?
You hold... I'm coming. My penis is too big.
Okay. You. It means that you need to check your fingernails as well.
Yeah.
Okay.
So when it is out,
okay,
you squeeze it. Then you put it in there back to the wrapper, and then when you have a newspaper, you just put it around it, and you put it in a black poly bag, and then you throw it away.
Yeah.
It's not supposed to put, you are not supposed to put it in your water closet. Yeah.
Okay.
So then you discard it.
You discard it just like that.
Yeah.
Okay.
That's why I said you put it in the back into the wrapper, and then you put it inside a tissue or a newspaper, and then you wrap it in a polythene bag. Then you discard it, preventing kids from going to take it and then playing with it. Because sometimes you see it, they will see it and then they imagine it as a balloon, and then they will be using it for balloon.
Okay. So do you have a female condom here, or you didn't come with female condom?
No.
Okay, then I think next time you need to come with a female condom. Yes, next time try and come with a female condom. Maybe I'll attempt another record, Guinness World Record, and
wow,
you need to come around to take us through these things. Very soon my next guest is going to join me, but then so after that you discard it.
Yeah, you discard.
Where is the appropriate place to discard condoms?
You discard it in a dustbin. Yeah.
Okay.
Yeah.
Not in
water
your water closet. It is not advisable.
It's not advisable.
Why?
It can block it because it's rubber.
Okay. Oh, just blocking
Yeah.
Okay. Okay. So that is the main reason why.
Yeah.
Okay. What else? And what is that? You brought another thing there. What is that?
That was for the female condom, but I couldn't get some.
Okay. You couldn't get some for us. Okay. So when are we getting that one?
Probably, let's say tomorrow I can get some.
Okay. Okay. So what else? What other education when you go out? What other things you teach?
We teach about child welfare clinic.
Okay.
That's the CWC.
What is child welfare clinic?
It's a clinic that we usually organize for babies. 0 to 5 years.
Okay.
We give them immunization. We educate the mothers on the food they are supposed to give to their kids, and then exclusive breastfeeding. We educate mothers on health prevailing issues and how to take care of their kids.
Okay. So that is it.
We give them immunizations to prevent them from the vaccine preventable diseases.
Okay.
Example like the BCG.
BCG.
Yeah.
What is that?
With the BCG, it's normally given to baby at birth.
Okay.
It protects them from tuberculosis, from getting tuberculosis.
Okay.
Yeah. So the moment you deliver, they give you BCG.
Okay.
And then when you are hepatitis B positive, they add the hepatitis B immunoglobulin to it.
Okay.
To prevent the child from getting hepatitis.
Okay. Very soon my next guest is going to join me here. So we are going to talk about some other few things here. Do you talk about how to prevent cholera? Because I know cholera at some point was serious,
very rampant.
Yes, very rampant. You educate people on that?
Yeah, we educate them on Any health issues.
Any health issue.
Yeah.
And in Ghana, for instance, I can talk for malaria fever.
Yeah.
It's not easy here in Ghana.
Yeah.
And how do we prevent it? Is it preventable?
Yeah, it's
because
preventable.
Sometimes you not feel well, you go to the hospital, and then doctors will tell you you have malaria, and sometimes you don't even remember the last time you had a mosquito bite.
Yeah, sure.
Where do we get them from?
From our workplace. You may not know,
but at least I should feel that bite, but I don't remember the last time I had a bite.
We have stubborn mosquitoes.
Okay.
Yeah.
So what do we do to prevent that? What do we do?
By sleeping under insecticide nets.
Okay, the treated ones.
Yeah, the treated ones. By weeding our surroundings, and then by covering our waters. Sometimes we have gallons or big bowls in which we fetch water, and we are supposed to cover it, because if you don't cover it, it can breed mosquitoes.
Okay.
Even if the water is clean,
okay,
it can still breed mosquitoes.
So we need to cover them.
Yeah.
Okay.
And then with the pregnant women, when you go to antenatal clinics, we give them SP.
Okay. What is SP?
Sulfadolphin parametamine.
Okay.
Yeah, to prevent them from getting malaria.
Okay.
Yeah, so that's some of the preventions.
Okay, for that.
Yes.
And then I think another thing, publicness you've been championing has to do with typhoid fever.
Yeah, typhoid.
Typhoid fever. I see a lot of your your education stuff. So typhoid, what is it? It's caused by what? Is it also by mosquito bites?
No, by death.
Okay.
Yeah, sometimes using unclean waters to eat, buying rotten tomatoes, example, to be
or
cooking,
vegetables.
Yeah, vegetables to be cooking.
What if you wash them very well?
So far as it's rotten,
it doesn't, because some people feel and think that I've washed them very well, so I can just cook.
No, you can't.
It means that we have to be careful about where we buy
food, and you have to make sure the food is warm before you eat. So when you go out and you buy food and you come home and it's cold, you are supposed to warm it before taking it inside. And sometimes our waters, some waters, our drinking waters, like the sachet one, we don't know where they manufacture. So by taking in those waters, you can get typhoid through that.
Okay, so sometimes you don't know the sachet water. Okay, so we need to be very careful.
Very careful with the water we drink, and
it means we need to wash our hands too before we eat.
Yeah, regular hand washing.
It can contribute to getting typhoid fever. Wow, regular hand washing.
No.
Okay.
By doing regular hand washing, it will prevent typhoid fever.
Okay.
Yeah.
And I don't know whether you still go rounds to educate people on COVID, or now we are not talking about COVID again. We
still go round.
You talk to people about COVID.
Yeah, we still give the vaccination.
Is it still in the system?
Yeah, it's still in
COVID
the system.
Is still around.
Yeah. COVID has come to stay with us.
Really?
Yes. So day in and day out, you have to get the booster. Yeah.
What is the booster? Because I've taken my vaccine. So what is the booster you are talking about?
Meaning, like, when you get the vaccine, it's for protection. As time goes on, the efficiency or the effectiveness of the drug goes down. So you have to get another jab to boost. The protection up. That's what we call the booster.
So everyone needs the booster.
Yes.
How often do I need the booster?
Depending on the number of times you've taken the vaccination. Some people has taken like 3 times, 4 times. Yeah.
So the booster will help your immune system
to build up to fight against. Right now, COVID is like our normal cold and stuff.
COVID is still there.
COVID is still
I thought there. COVID is gone and we are free.
No, it's still there, but not like first.
Would you advise us to be wearing nose masks? Do you think,
Yeah.
as a public health nurse practitioner,
going
you think
to overcrowded areas, not only necessary because of COVID.
okay,
Example, tuberculosis,
okay,
TB, to prevent
someone can cough and can transmit to you.
Get it.
Okay,
you can
so
get cold and stuff. Yeah.
So prevention is better than cure.
It's better than cure.
So COVID has come to stay.
Yeah, COVID has come to stay.
We should accept that.
We should accept it. COVID is with
You were talking about COVID vaccine boosters.
Yeah.
How often can I go for the booster? 6 months or yearly or something?
6 months.
Okay.
Yeah, 6 months.
Yeah.
Yeah.
Okay.
It's 6 months intervals.
Okay. And then with hepatitis B and the C as well, when you take the vaccines well, does it help?
Well, yeah, it really helps, especially with the B.
Okay.
People are not having much knowledge about it.
Okay.
And with that one, when the virus gets into your system, it attacks your liver.
Okay.
And damages your liver.
Wow.
So when your liver is damaged, unless you go for liver transplant, and with that one, nobody can. It's not everyone who can afford
the cost
liver.
involved.
Yeah. So it's better to get the vaccine before it's too late. And with the Hep B, it's a silence killer.
Okay.
You may be having it, but you may not show signs and symptoms. Before the signs and symptoms start showing up, meaning your liver is being damaged. Yeah. That's why we usually educate the public on regular medical checkups and screening.
Okay.
Yeah.
So we should be doing that.
We should be doing that. And mostly with mothers who get pregnant and they don't go for antenatal clinics. At the end of the day, they will give birth and then the child will be hepatitis B positive or HIV positive.
How often do we have to be taking water?
Regular.
Every day.
Every day.
We need to be taking water.
Water is life. Yeah.
So every day.
Every day, every time.
Wow, we should be taking water.
Yeah, it washes your immune system. When you sweat, your body is not supposed to be dehydrated.
Okay.
So the water keeps our body from regulating.
Sometimes, how do I know my body needs water? Is there something you can check? Is there something we can do to know that your body needs water?
Yeah,
how do I know?
Sometimes your throat will be dry and then your lips will be dry. And sometimes your skin, when you pull your skin, it's returning back. It takes some time. Then you know your system needs water. Yeah.
So you need to check, and then you have to take in enough water.
Yes.
And as you mentioned, clean one, of course.
Yeah, clean one.
We should have clean.
Yes, please.
Okay.
Not any ordinary water. Not any tulale water. Yeah.
What of tap water?
No.
We shouldn't be taking tap water again.
Please.
But Madam Ness, this is what we've been taking all these years.
Yeah, but most of where the waters are coming from, the minings and those kind of things have destroyed our waters and stuff. So it's not safe for us to drink it, but it's safe for cooking.
Okay.
Because we will boil it. Before.
Okay, so it's better you boil before you use.
Yeah.
Okay. How long have you been practicing public health nursing?
For 8 years now.
8 years.
Yes.
Wow. And
currently I'm just done with my Bachelor of Public Health.
Okay.
Yeah.
And you still want to pursue?
Yeah, I want to do my master's.
Okay.
Yes.
Then you'll be a doctor. Or
Amen.
Or you don't want to be a doctor?
I want to be a doctor. I want to be a regional minister one day.
A regional minister?
Yeah, for health.
Okay. Be in charge of health. You sound so positive about health. It means that it's so important to you.
Yeah, I have this kind of passionate for the job.
Growing up, this is what you wanted to do.
That was what I wanted to do.
And you are at peace. This is what you do. How do you treat your patients?
I
understand some of you are very harsh on your patients. How true is it?
Yeah, individual differences. We are all nurses and doctors are normal human beings. We go through problems in the house, psychological problems and stuffs. Yeah. So sometimes when the clients come, they will rather irritate the nurse. Then they will say nurses are. But nurses don't respect, and nurses have been taking people's husbands, and
is it true?
That's what they've been saying.
But is it true?
No, it's because of the care and attention we give to them.
You give to their husbands?
No, to people, the general public.
No, is it the care and attention you give to people's husbands?
Not people's husbands.
When they come to the hospital.
Let's say when you come to the hospital and then you are sick.
Okay.
Yeah, and then I render health service.
Okay.
Yeah, with the kind of attention I will give to you. Maybe your wife may not understand.
Okay.
She may.
So they sometimes fight you people?
They sometimes fight.
In the hospital?
Not necessarily the hospital. Sometimes they come to the hospitals and fight us.
But have you been in such situation before where someone was angry at you that, hey, you are my husband is here, but why are you not in the hospital?
No, but normally when let's say when they come for CWC clinic, and then let's say you attend to someone, and then meanwhile they came first.
Okay.
With that one, if you don't take care, they will just.
Has someone fought you before in the hospital?
Yes.
Why?
She said she came first, and the card were mixed up, and unfortunately, the first person's card was under. And then she just got annoyed, and she started insulting us. So you and nurse, you have to calm yourself down and then apologize. Patient is right.
They are always right.
Patients are always right.
Hey.
Yeah.
How true is that?
Oh, it is true. Yes. So you have to calm down, and then because you are trained, you went to school, you were trained for that.
Okay.
That patient is not trained.
Okay. Okay, so these are some of the challenges you go through.
Yeah, we go through, and our salaries.
Nurses, your salaries are not good.
Not.
I thought you are getting paid.
Hey,
you are
not.
Okay, don't. Your nurses' salaries are not good.
Not good at all. That's why most of us are running away.
Running away to where?
UK, Canada, and stuff.
Wow, because a lot of nurses are traveling.
Yes.
Is it because of salary?
Yeah, because of salaries. And then sometimes when you complete school, you have to be in the house for some times before you have been posted and stuff.
Yeah.
And then you not get job doing, and your parents still have to feed you, and the kind of depression and stuff. So that's making people traveling outside.
Wow.
The nurses.
Okay.
Especially for greener pastures.
Are you going to travel outside the country one day?
No, I just want to stay in Ghana and then work.
You want to stay in Ghana?
Yeah, I just want to. I love Ghana.
Yes, I know you love Ghana, but should you get an offer somewhere?
I love my people. Yeah.
So you want to stay here?
Yes.
Okay.
If all of us leave, who is going to take care of?
So you are not leaving?
No, I'm not leaving. I'm here.
Okay. So the name once again, the name
Linda Kosa.
Linda Kosa.
Yeah.
Okay. So where you attended school? Where did you have your training?
I went to Eziama nursing training.
Okay, Eziama Western. Yeah.
And then I went to do my degree at the University of Allied and Science. That's the Volta region.
Okay, so you has okay.
Yes.
Okay. I've enjoyed this conversation, and I want to say a very big thank you to you for honoring my invitation.
You're welcome.
And as for nurses, you are very special to me because my wife is a nurse. So
wow.
Yeah, nurses are very, very special to me.
Wow.
So thank you so much for this education. I've enjoyed your interview as well. So I wish you well, and we'll meet for more education.
Okay.